Hi, I'm Jasmine. I'm from the Respiratory Therapy Department of Armstrong, and today I'm going to be showing you all how to perform a tracheostomy care. First, you need to evaluate the indications. Indications such as if the patient is tachycardic or distressed, and it depends on the amount of secretions that the patient has. Next, you will review the chart for significant findings and data such as for doctor's orders. Next, you will gather equipment such as disposable gloves and tracheostomy kit. You also need hydrogen peroxide and sterile water and a manual resuscitator if needed and suctioning. You would also need to apply 3 milliliters or more of alcohol base on hands and at least rub on for 15 seconds. Next, you will introduce yourself to the patient. Then you will explain the purpose of the procedure, the risk, and the safety precautions. Next, you will confirm to the patient and the family member the understanding of the procedure. And I will also tell them the complications of the procedure, which can be bleeding, hemorrhage, and infection. After all that is done, you can now start the procedure. First, you need to put on your disposable gloves, making sure not to touch the outside of the glove, just touch the end of the glove. Next, you will need to open the tracheostomy kit. You will take out a padding, which is a padding to put your sterile equipment on, making sure you're not touching the um, inside or the middle of it. Just touch the corners of the sterile padding. Then you will take your sterile gloves, which is inside this paper wrapping, and you can just place it over the patient's chest. Next, I usually just dump the equipment out onto the padding. Just dump it onto the padding and place the container to the side. Next, you will put hydrogen peroxide in the container by itself, and you will put H2O, sterile H2O, into the container by itself. Next, you will put on your sterile gloves. Making sure not to touch the outside of the glove. Then you take the other one. Making sure not to touch the outside of the glove. Okay, next you will take the cotton tips, moisten it with hydrogen peroxide, and you will remove the 4x4 gauze, the old 4x4 gauze, put it to the side, and you will take the moistened cotton tip and clean around the stoma, going from the inside to the outside. Inside from the outside. Okay. Next, you will apply antibacterial or antifungal cream onto the patient's stoma. Okay. Then I will remove the inner cannula and place it into hydrogen peroxide. So as I'm doing it, I'm securing the tracheostomy so that I won't pull the tracheostomy out. So you twist it, the inner cannula, and place it into the hydrogen peroxide. Then I will take the inner cannula and take the brush, and I will clean the inner cannula from the inside and out. Clean it to get all the secretions off from the inner cannula. Then I will place the inner cannula into sterile H2O before putting it back into the tracheostomy tube. Okay. Then I will take the inner cannula, and I will place it back into the tube. I'm making sure I have the tracheostomy tube secure, and I place it back into the tube until I hear a clicking sound of the device. Then I will remove the old ties, making sure I'm holding the tracheostomy tube as well, making sure I'm not pulling it out, making sure it's secure. Then I will take the new tie, okay, putting it in here. Then I will tie it, making sure it's secure. Okay. Just making sure it's secure. Then I will reconfirm the tube position, and I will put make sure that at least 2 to 3 fingers can fit between the patient's neck and the tie. Then I will take a new 4x4 gauze, and I will place it around the stoma or tracheostomy tube. Making sure it's neat and perfect. Then after that, I will dispose my gloves and the used equipment. Okay. Dispose all of the gloves and the used equipment. Okay, now before and after, you should always check your heart rate, respiratory rate, sat, breath sounds, and CO2. So after I finish everything, I make sure I do that. And to make sure that the tracheostomy tube is secure or stable, I can order a chest x-ray. And if there's a need for suctioning, I can also do that as well. And after everything else is done, I can provide the patient with a talking device such as a Passy-Muir valve or a fenestrated trach tube. Now, the tracheostomy care has to be done at least PRN or after every shift. And that's how you do tracheostomy care. Thank you for watching. Y'all have a blessed day.